how to become a doctor in US and how to get into a residency program, how to match successfully into an RMP. This is a very pertinent topic for foreign medical graduates. I was a foreign medical graduate 35 years ago, and it is very possible provided you follow three things. One is strategy, second is patience, and number three is perseverance. What do I mean by that? Why do people want to come to US? Because it's the mecca of medicine, it is the epitome of medicine, so on and so forth, but also it allows you to have a very good infrastructure, lifestyle, financial stability. That's the reason why most of the FMGs want to come here, and also the fact that the things might not be so good in their home countries. Is it easy to become a doctor in US? No. It is not easy to become a doctor. It requires hard work, it requires strategy, patience, and perseverance, right? It is fairly competitive. There are 48,000 residency spots in US. Of these 48,000, 18,000, one third is occupied by foreign medical graduates. So 1 in 3 physicians already is a FMG. But this is where the competitiveness lies. From all over the world, there are about 60,000 applications, and of which 18,000 would be FMGs. These are the people who are matched. So 1 in 3 is an FMG. So if you're thinking it is very difficult and impossible, no, you are going to get it. If not in the first year, have patience and perseverance. In the second year, you'll match. If not, in the third year, you'll match, because 1 in 3 physician is an FMG. So you just have to wait for your chance. Okay. So that is where the concept of, in addition to strategy, patience, and perseverance is important. Now, I'm going to come down to the strategy part. September 25th is the deadline for application for 2025 match. You have to begin 1 year before, September of 2024. Now, this 1 year, you'll be able to do your USMLE Step 1, USMLE Step 2, you'll be able to do clinical rotations, secure a visa, come here for clinical rotations, maybe do some research, and then do Step 2 and be on time to apply for IRAS application and an RMP match by September 25. So I'll give you the strategy and timeline, which a lot of people lack. So September, October, November, knock off Step 1. We don't want an attempt because that's a filter. You are going to be out, so no attempt. September, October, November, sit down, prepare for Step 1, khalas. December, January, February, March, you should come to US for doing clinical rotations and maybe some tele-research rotation. Okay, you get visa sponsorship letters, which you can start working in the month of September, October, November as you are preparing for Step 1. So try to secure a clinical rotation in December, Jan, Feb, March. You will do 3 clinical rotations. However, when you're doing clinical rotations, you're not doing clinical rotations all day long. It's for 4 hours. You are in the hospital. The rest of the time is yours. Start studying for Step 2. 3 to 4 hours per day. You can easily do it. So December, Jan, Feb, March, soft preparation for Step 2, 3 to 4 hours. But at the same time, you're doing clinical rotations. That is important from your USCE point of view, very critical. So by March, you are done with Step 1, you are done with clinical rotations, and you have been preparing. Now, April, May, June, July, 4 months, I want you dedicated for Step 2, 10 to 12 hours per day, 8 to 10 hours per day. So you have done a soft study for Step 2, and you are doing intensive dedicated study in April, May, June, July. This will get you a good score. A good Step 2 score is the single most important factor in your selection. So by August 1st, you appear in Step 2. End of August, by September 1, your Step 2 results are going to be back. So you are done with Step 1, Step 2, clinical rotations. Now, September 1 to September 20, fill out the IRAS application form, 4 to 5 page. You are done. Khalas. Put in all the information that you have up until now. So IRAS, CV, public personal statement, from September 1 to September 20. Application is out. Your job is done. Now, I have another video in which I have emphasized step 1 and step 2 preparation. Please go and check out that and see that. I'm also going to create a video for clinical rotations and research. What should you look for in that? How should you select? So December, Jan, Feb, March period, right? And also a video will be coming through for IRAS and CV and personal statement. But focus in the strategy and timeline I've given you. Connect with me on LinkedIn or Instagram and I'll be happy to help you. Very easy to do. Go ahead and do it.